Formative data on our project was collected through surveys of service providers and people with disabilities found through the employment networks, as well as rehabilitation counselors and more people with disabilities found through state VR agencies. Focus groups and interviews were also done with employment system personnel and PAS users. In addition, qualitative in-depth phone interviews of 30 minutes to 1 hour were done with employers who had PAS users or had participated in events related to employment of people with disabilities, employment organizations like vocational rehabilitation agencies, job developers and the like, and PAS users. Conscious efforts were made to vary who we talked to, including for employers varying by region, size, business type, and industry, for the employment organizations varying it by the region, size, types of industries served, and types of disabilities served, and for users of PAS at work by gender, race, ethnicity, type of disability, and type of industry worked in. Through these interviews, we spoke with 36 employers, as you can see, 19 employment organizations, and 58 PAS users. Combined with data collected by the Job Accommodation Network, which conducted the survey, focus group, and interviews, we've had a list of findings that I want to go over. But first, I want to give you a few observations that I think are relevant that come from that data collection. It's clear that some federal and state agencies were more prepared to handle both work task and personal care PAS than corporations. It was also interesting to note that extra recruiting effort was really needed to find private organizations that know about PAS. They're aware of the ADA requirements, but few had any experience in it, and fewer still had any experience about personal care. Extra recruiting effort was needed to locate PAS users in some areas, such as those who worked in private organizations, not a surprise since not many of the organizations were aware of it themselves, and in terms of people of color. And finally, corporate PAS experience seems to be more integrated with the valued existing employees than necessarily with new hires. Now, if we look at some of the findings of PAS users, they reported to us that employers are more familiar with task-related PAS than personal care-related PAS. They also reported the need to search for their own funding sources, such as public benefits, trying to get the employer to cover it, paying for it themselves, finding Medicaid dollars, using private insurance, or cobbling together some combination of all of those amounts. They reported wide variation in waiting times to receive PAS, from immediate to sometimes even years. They reported having to deal with attitudes of supervisors and coworkers when they requested or received PAS, as well as their own attitudes about whether they even wanted to request PAS for fear of rocking the boat or jeopardizing their own job. The employers also reported barriers that, which can be classified into these three main areas. First seem to be in terms of costs. The perceived cost to the employer was mentioned frequently. They were always concerned, oh, this is going to cost too much, we don't want to do this, you know, whatever their cost concerns were. There was the perceived cost to the work unit. So in the organizations where the supervisor was required to make a decision about whether to provide this PAS, they didn't want it to come out of their bottom line for fear of making their work unit look less efficient than anyone else's unit. And they were concerned, organizations were also concerned about the risk or insurance, risks and insurance issues that were related to having a personal assistant in their facility, especially for personal care types of work. There were also attitudinal barriers. The coworkers and supervisors had attitudes of the like of, gee, I'd like to have that as well. How come I don't have somebody who's helping me do that? Or supervisors saying, oh, this person's just shirking their responsibility. They don't really need this kind of a person. They're just being lazy. The employee attitudes were also part of it, as I've just discussed. They're concerned about revealing or rocking the boat. Company structure seemed to also be a barrier area for employers in terms of employee preparation and awareness. How were people even made aware that they could approach the company to have any kind of PAS be made available to them? The waiting time for PAS in terms of accommodation, as I mentioned before. The space needs for additional people. Where do you put this person? Some organizations were concerned. Where do I sit them? I have a little cubicle. Do I give them a larger space? How does that work? And there were even in some circumstances issues of what happens if I have a secure site and now I have this other person. How do I get them into this? And should I be getting them into this secure area? But there were some promising practices that we identified and we searched for. We did some case studies, and we based our case study on a literature review and our own data collections through the surveys, focus groups, and interviews, and self-nominations that came in through the center's website and through the Job Accommodation Network's website. We did telephone interviews with the initial contact, with the HR people, the financial people, and employees who used workplace PAS at the organization. And our criteria for what was a promising practice include, did it contribute to the hiring, retaining, or promoting of workers with disabilities? Was it part of the organization's written policy? And had it been in place for at least 6 months so that there was some longevity to it at all? And that it reduced or eliminated one or more of the barriers that I just went over for you. First, looking at cost barriers, we found some practices that addressed costs to employers. The first one was this idea of a shared personal assistant. So, several sites have variations on this. Some hired a person on staff whose primary responsibility is to assist the staff with disabilities as needed with work related help persons with disabilities as needed with work-related tasks or with personal care. When this person is not assisting people with disabilities, he or she also functions as a receptionist, taking calls or doing like clerical work such as copying or filing, or if the tasks were higher level, even who they were working for, they could even work in higher level kinds of tasks. A few organizations used outside contractors as a way to deal with the cost. It's most familiar probably for most of us in terms of having sign language interpreters and bringing those in from the outside. Some organizations discovered funding from state or federal sources to assist them in funding of PAS. One combined DD funding, VR funding, and school sources for on-site support with those with developmental disabilities, mental illness, or traumatic brain injury who needed follow-along support. The use of the state's Medicaid waiver can extend help for employees with funding of personal care PAS. And one employment organization used a state contract to provide employment assistance, especially for employees with mental illness. Some practices address the costs to the work unit. Some employers have a centralized accommodations fund. And in that circumstance, that decision-making then was pulled away from the work unit and resided in the organization as a whole, so that the work unit didn't have to undergo that decision-making that I was describing before. Some organizations had a combination where both the central accommodations fund and a work unit accommodations budget were sort of both tapped together. And in two of those cases, the departmental contribution was about $500 per accommodation, and anything over that went to the central budget. And we are still interviewing people right now on the issue of risk and insurance